Music therapy is well known in helping to reduce anxiety and stress, as well as pain management in many healthcare settings. Yet it would seem that it hasn't been fully investigated in patients who have had to have one of the most extreme cancer-surviving operations available, the radical mastectomy. This life-saving surgery is where the whole breast, the lymph nodes and the muscles under the breast are removed. As you can imagine, due to this operation, all of the nerves found around the breast area are damaged. And this results in the patient being left to struggle with chronic pain. In China, researchers carried out an 8-month study with a total of 120 women who were to have this surgery. These women were randomly divided into 2 groups, where one group was to receive music therapy and the other group was given the standard care and pain relief. Right from day one, the patients in the first group were given music therapy twice a day for half an hour. This treatment continued all the way through their medical care, right up until their 3rd session of chemotherapy. All of the patients' pain scores from both groups were monitored and evaluated after 3 post-tests. Once all of these results were examined, what could be seen was that the women in the music therapy group had radically felt less pain in comparison to the non-musical group. Now, why is that, you may ask? Why does music have such an effect on pain? The researchers have gone on to explain the different reasons of why music can help alleviate pain so well. Now, one of the reasons is that pain is transmitted from the point of the wound through the spinal cord, which then goes directly to the brain. And it is apparently there where the pain is actually perceived. They go into detail explaining how the spinal cord has a type of neural gates where the pain impulses travel through, and that these gates can open and close to certain degrees depending on the amount of impulses that are travelling to the brain. Right, so now the important question is, what controls these gates? Apparently, this all boils down to messages that come from the brain via different pathways in the spinal cord. Now, interestingly, this is exactly thought to happen with music. So, the more musical messages descending results in fewer pain impulses being able to slip through the gates, which obviously means that we become less aware of the pain that we are in. Without a doubt, this interesting study has given us a lesson on how and why music therapy is incredibly valuable and beneficial in alleviating chronic pain for those who have had, in this case, a mastectomy.